Today, I'll be presenting on the rise of generative AI in healthcare research. We'll explore how these tools are transforming research practices, their benefits, risks, and what this shift means for us as emerging research professionals. Generative AI or Gen AI refers to the AI tools that can create new content like text, images, or data based on the patterns in existing information. In the healthcare sector, Gen AI is already being used for medical documentation, literature reviews, data generation, and clinical decision support. This presentation will focus on how generative AI is influencing healthcare research and how we, as research analysts, can use it responsibly and effectively. So let's look at some key applications. In diagnostic, generative AI can analyze medical images like x rays or pathology slides, often improving both speed and accuracy. It can also generate synthetic datasets. This means we can stimulate patient data for training or testing without risking privacy breaches. Tools like AI scripts help automate clinical note taking, allowing healthcare professionals to spend more time with their patients. And finally, the generative AI can help with literature reviews by summarizing and synthesizing the research findings more quickly. While generative AI brings many advantages, we also need to be aware of its ethical challenges. One issue is transparency. We often don't know exactly how the AI is making decisions or what data it was trained on. Privacy and consents are critical concerns, especially when the tools interact with sensitive patient information. Bias is another major issue. If the training data is limited or diverse, generative AI can reinforce health disparities. And we also need to be cautious about the false information. Sometimes generative AI generates content that sounds accurate but is actually incorrect. So let's look at the benefits and risk of generative AI. On the benefit side, generative AI offers greater efficiency, helps reduce repetitive tasks, and allow us to scale up research efforts. However, there are risks like spreading misinformation, producing biased outputs, and becoming too reliant on AI tools without proper human oversight. The goal should be to use the generative AI as a support tool, not replacement for thoughtful critical human input. As future research analysts, it's important we build our AI literacy. This means understanding how generative AI tools work, how to use them ethically, and how to critically evaluate their outputs. We should also be able to recognize the bias and apply appropriate evaluation frameworks and think about the real world implications of using these tools in healthcare. To wrap up, generative AI is also reshaping the healthcare research. It can help us work faster and more efficiently, but it also raises new ethical questions. As professionals, we need to use generative AI thoughtfully, leveraging its strengths while staying aware of its limitations and risk. Thank you for your time and attention. I'll be happy to answer any of the questions